And welcome back. The Department of Health has issued a public alert on the rise of rubella cases in the country. The National Institute of Communicable Diseases, the NICD, has reported a total number of 10,137 lab-reported positive cases between January and November of this year. Let's make sense of this with the Executive Director of the NICD, Prof Adrian Puren. Prof Puren, thank you so much for joining us. Really do appreciate it. How worried should we be about the spread of rubella disease?
Not at all. In fact, I think the purpose of this announcement is really just to alert the public that compared to before 2020 and with COVID, that we had fairly small numbers of rubella. In fact, we didn't really have rubella seasons at all compared to prior to COVID. However, as a result of all our interventions, of course, a large number of children have become susceptible to rubella, and what we're seeing now is the unprecedented numbers of infections, as you said, about 10,000 lab confirmed. Rubella is certainly spread by respiratory droplets. However, it's not as infectious as other diseases such as COVID or measles, for example. And the outcomes in terms of rubella infections are really self-limiting. The only concern that we have, and that's part of the reasons why we had this public service announcement, was really just to alert, in fact, pregnant females who may have a rash that could be rubella-like, or if the person comes in contact with a person who has rubella, really to be managed appropriately because of congenital rubella syndrome. So that's the only really reason. So there's no need to panic. We are in the holiday season now, deep into the holiday season, and of course with the schools closing, workplaces closing, the likelihood of marked infections is unlikely, and we should really be seeing declines in the numbers of cases.
Perhaps for part of the public education here, what is the epidemiological characteristics of rubella? Is it flu-like, or is it an approximation of measles, perhaps chickenpox? How does it present itself?
Sure.
And perhaps what are some of the low-hanging remedy, non-pharmaceutical remedies that are available to those who might find themselves infected?
Yeah, so what we've seen over the decades, in fact, is what is called a rash-like surveillance system, in fact, and we're really looking for diseases that cause rash-like illness. And the two that we're really focusing on are, for example, measles and rubella. And these present very similarly, like, as you said, they could present with, and in particular in children, especially children under the age of 15, could present with a rash-like illness, especially on the face, with some lymphadenopathy and fever, red eyes, for example. And these can be really self-limiting, and the management, therefore, is really symptomatic treatment. So it's no major disease outcomes compared to, for example, measles and other respiratory-like diseases.
Does the rash have a particular texture?
Yes, it's what we call a maculopapular rash, so that's really seen around, as I said, around the face and part of the body as well, yes. So it's, again, that's why I think we do the lab testing in order to try and distinguish whether this is a measles-like illness, or whether it is, for example, rubella or some other non-specific or other viral causative agent.
What is the expected recovery time here? You said self-isolation, rest, presumably hydration would be part of the non-pharmaceutical remedies that one would have to look at. But what is the expected recovery time? And I ask this to perhaps ask the question, at what point should those who have the disease be worried and contact their doctors for perhaps a more specialized intervention?
Yeah, so it should be self-limiting within a few days, 4 or 5 days or thereabouts, for example, and the rash should really clear. I think, as I said, the main focus for us really is around women who are pregnant, especially in the first trimester, who either present with a rash-like illness that could be rubella, or has come into contact with a person who has had a rash-like illness and or confirmed rubella. That those are the sort of individuals that we really would like to target and request that they be managed appropriately. Because given the fact that there's some more severe outcomes for those individuals.
What are those? What are the embryotic effects of rubella on pregnant women?
Yeah, so in terms of transmission, these can be transmitted, especially the early stages of rubella. This is where the early stages of pregnancy that we're really concerned about, because this is where the embryo is growing and developing. So the virus affects multiple organ systems, and this presents at the end of or during the pregnancy as a congenital syndrome that needs to be then investigated.
Right.
But it's very rare. So I think, that, again, I don't want the public to panic.
Right.
I think we just need to know that it's rare, because we know that in South Africa, at least, because we've not had a vaccine program in the public health sector, which we now do have, the majority of individuals will have been exposed and have natural immunity to rubella.
Yeah. If there are pregnant persons that perhaps have contracted rubella, are there some interventions that can limit the adverse effects it could have on their embryos and or fetuses?
Yes, I think the risk is primarily at the initial stages during the first term, and therefore the pregnancy has to then be monitored and managed appropriately, and obviously at time of birth to do the necessary investigations to determine that the infant has not been infected. So those are the major focuses that should be these individuals.
Yeah. Will the NICD continue to track laboratory tests of rubella?
Certainly. So, as I mentioned, the South African government has introduced a program for rubella vaccination as part of its measles vaccination program. So, again, this should, I hope, be the last time that we see such large numbers of cases. And with the introduction of the rubella vaccine with the measles vaccine, we should see a decline in these cases, or these types of events that we're currently seeing. So, again, I would really encourage mothers and parents really to make sure that once the program is really up and running, really get their children vaccinated.
Prof Adrian Puren, thank you so much for your time. Really do appreciate it. Prof Adrian Puren is the Executive Director of the National Institute of Communicable Diseases.